2 weeks ago, I had a wonderful experience. I was invited to be the Master of Ceremonies for a conference that was in Nashville called the DSO Leadership Summit, the DSO Leadership Summit. And the doctors that attended that leadership summit were a particular group. These were dentists that had anywhere from 3 to 30 locations. Now, there were outliers beyond that, but that was the apex of the bell-shaped curve of the attendance at that conference. So these are dentists, dentist-owned DSOs, where they have anywhere from 3 to 30 locations. And by the way, these were dentists that, as I studied we had 500 attendees there. It was invitation only, had 500 attendees. And as I got to meet these dentists, they spanned, you might be surprised, Aaron, they were across every age segment in dentistry. There were young dentists that were part of this. There were mid-career dentists, and there were late career dentists that were part of this conference. Does that surprise you at all, Aaron, or is that something you might have expected?
Yeah, I would have expected it because I think more and more young people are entrepreneurs. It's just because, I think their role models are like Elon Musk and Steve Jobs growing up. So I guess they are feeling, they want to be like that guy who's an entrepreneur.
And one of the things I also noticed is that there can be many motivations for doing this. But when I met with many of these doctors individually at that conference, one of the things that I noticed is they had a very good practice culture about serving people, serving patients, serving their community, right, serving their team. In other words, this was not just an economic play to make more money. By the way, there's nothing wrong with that. Naren, you're a capitalist. Yes?
Yes.
Yeah, I'm a capitalist.
Yes.
I'm an absolute advocate of capitalism as the best economic system on the planet. And I believe that all of our listeners are capitalists as well, except for those that are running nonprofits.
Right.
And if they're running a nonprofit, they're running a nonprofit not by choice. Sadly. So if we have any listeners that are running a nonprofit not by choice, listen to more podcasts because it needs to be a for-profit enterprise. All right. So, but I do want to emphasize that the majority of the attendees and everyone I met with, they had a service heart. They were interested in serving others, serving more patients, serving their community, serving their team members. And I love that position to start this from. Now, certainly there's economic rewards as well. No denying that. But so if you're listening to this and you're thinking that might be something I want to do, what would be the pathway to do that? I'm going to make a very, very opinionated suggestion here. I think before you think of adding locations, adding another location, the first thing that you should do is you should develop a mothership, a practice that serves as a proof of concept, and develop that mothership to full potential. Now, Naren, as I met many of these dental entrepreneurs at that conference in Nashville, that was exactly what they did. So have you ever heard that saying, Naren, that if you want to be successful, do what successful people do?
Yes.
Many of them said when we had panel discussions, and we'd have panel discussions, and it might be, hey, tell your story. Tell a story of how you got from where you were to where you are today. And in many cases, they said just that. Well, I had one practice. I wanted to optimize that and develop the full potential. Wanted to get good systems in place. Wanted to have good team members. And once we had that, then we started looking at other opportunities. So I'm using that in the kind of creative terminology I'll use is called the mothership. So now you have your mothership in place. Now, is a practice ever fully optimized? What do you think, Naren?
No, I personally, as an entrepreneur, I believe that business is a work in progress. You can continue to improve it. You can continue to go after new opportunities. So it's like never done.
Yeah, you're always going to get better. But there should reach a point where you say, hey, we've got something here that's really cool. We're going to work on getting better tomorrow, but we've got something here that's pretty cool. Let's look for another opportunity. And
so you're saying, like, let's say you get it to an 80, 90% state, like of what perfect is. Now you are duplicating it. You're like doing +1
now
and then +1.
Yeah, now you can scale. I happen to think, I'm going to get kind of granular with you. I happen to think that the best model in a practice is to have two or more doctors in the practice. It could be, if it's two, it could be an owner and an associate. It could be partners in the practice. For lots of reasons, we can cover more hours for our patients. We can provide more hours for our team members that need that, and providing a work-life balance for our doctors and our team, in a model like that. And you can develop that practice, fully with two doctors. I would also be mindful of expenses as you do this, and I would be thinking about optimizing your space as well. In terms of, you don't necessarily need a huge office to be able to do this. A two-doctor office could be a 6-operatory office. Ideally, I'd like one more. I'd like 7 to give us a little bit more growth possibility. But a 7-operatory office, Naren, is not necessarily a big office, and it's not going to have a big, real estate investment or a big lease cost in terms of that office space. Does that make sense?
It makes sense.
Yeah, and then scale, and you can scale a number of different ways. One way that you can scale is you can go out and acquire another practice. Buy one and add it to your group. Another way is you can do a de novo, do a startup. De novos can still be done, but they have to be done much more, research has to be much more complete with doing a de novo. You have to make sure that the area isn't saturated with dentists, that there's an opportunity to start from scratch and grow. However, many of these doctors, as they told their story, as they talked about their growth, they actually used a combination, Naren, acquisition and startups in some way, shape, or form. But now imagine that we're doing acquisitions, we're doing startups, and there's a third opportunity to grow. And that third opportunity to grow is to grow same practice growth, really optimize each individual practice and have same store growth. Now, because I know our listeners are kind of tuned into this kind of thing, I want to share a potential model with you. And imagine that each location you could grow into somewhere between a $2.5 and $3 million annual practice in terms of collections. And that would be 2 doctors and a strong hygiene department. Could be done in 6 operatories. 7 would be even better. Somewhere between $2.5 and $3 million in annual collections. That's something that 2 doctors and a strong hygiene department could do. That would be a wonderful model, to grow your practice on.